Right, I think we'll start then. Good evening, everybody. I'm Dr. Nilmini Vijayasuriya. I'm consultant anesthetist working at Ragama Teaching Hospital. And Sri Lanka had a few COVID patients needing intensive care for more than 1 year and until this recent third wave. And there were designated COVID hospitals, only a few of them. And therefore, we did not have a lot of patients in our hospitals. But with the third wave, we have seen a lot of patients getting admitted to almost all hospitals in the country, and we had to open new ICUs, new COVID units, and which has resulted in tremendous moral injury to many healthcare workers. And today, the college does know and aware of this emotional impact of COVID in healthcare workers. And that is the reason why we organize this webinar to help the healthcare workers to understand and find ways to deal with this emotional impact of working with COVID patients all the time. So we have three speakers today, experts in their specialties. Dr. Asiri Rodrigo, he's a consultant psychiatrist now working in Mornington, Australia. He's going to talk to you about stress, burnout, and post-traumatic stress disorder. He had been one of our own consultants at Ragama Teaching Hospital, and he has left us to Melbourne. Dr. Chaturi Suraveera, Senior Lecturer in Psychiatry, Faculty of Medicine, Colombo. She's a consultant psychiatrist at National Hospital of Sri Lanka. And Mr. Deepal Suryarachi is not a doctor. I can call him a mindfulness executive. And he's a management development consultant who has a lot of experience in working with business community, increasing their work capacity by teaching them how to be mindful and use this for day-to-day practice. And thank you very much for all the participants and the speakers for joining with us on behalf of the College of Anesthesiologists and Intensivists of Sri Lanka. And please type your questions in the chat box. After the three speakers, we will take the questions and discuss and try to see what we can do to make things better during these unforeseen times. So over to you, Asiri, to start with your talk on the general description about stress, burnout, and post-traumatic stress disorder. Thank you.
Thank you, madam. Thank you, madam, for the invitation. But most importantly, thank you, all of you, for being here, and as well as for what you do, like for Sri Lankan people, and for being here on a Saturday evening, like after working whole week, like long shifts, with little or actually no rest. And like I know, like some of you work under very trying and extreme circumstances where you have to wear full PPE in Sri Lankan heat. Like it is not easy. And it is also, I think, like you have a feeling of working, like being on a knife edge all the time, of the risk of infection, like irrespective of your vaccination status, and passing the virus to your loved ones. And I don't think your uncertainty ends there. Like it is also about like keeping up with new developments, delta variants and various other things, what it means and like what we have to do, and like dealing with new techniques as well, doffing off, doffing on, and things like that. And then dealing with new technologies, like some of the new ventilators, like how to operate those things. And I think the loss and grief has become a kind of integral part of your life now, because many patients dying irrespective of like what you do. And these deaths are not what you're accustomed to as the physicians or the emergency physicians or anesthetists or like doctors, nurses, and healthcare workers, because many of them are healthier and many of them are younger. And I think most importantly, they die alone. Like, I think taking the family out of the equation from a dying person is like very tough. I know that because when my father was dying, like I was fortunate enough to be there with him. Like I knew exactly what it meant for us, and I did not know exactly what my father was thinking, but I saw it in his eyes, like he actually appreciated it very much. Yeah, so like this means actually you as physicians, you as nurses have to comfort a person who is dying without their relatives and without their friends around them. And not only that, you have to contact the relatives, inform relatives, and console them remotely. You can't even go and like talk to these relatives. You have to like console them remotely. And as like like we were discussing before, like you go through all these things in a relative isolation because of the lockdown, so you don't have all the kind of friends and relatives around you as well. So it is very tough. It is a loss in itself, and like you have lost time with your family. Some of you may have lost income as well, and others may have to kind of postpone the very important engagement and events in their life, such as weddings, exams for certain trainees, and like going abroad for like the people who are waiting for foreign training, and so it is a very tough time for all of us. So the people who go through these things will have different emotional reaction. All of will get affected by these things, but how they get affected by these things would be different according to like their resilience and various other factors, as well as the supports that are available to them. So in the next 15 minutes or so, like what I will try to do is I will try to discuss about what kind of impact, emotional, psychological, and moral impact it may have on you, as well as what we might be able to do in order to mitigate as well as manage these emotional, psychological, and moral impacts. So, many of you might actually feel stressed, but the thing is whether we will acknowledge and recognize it as stress or not is a um, questionable thing. So I will discuss a bit more about like how this stress may manifest. Like you will see irritability and anger. So the probably the most correct terms to use in Sinhala would be නුරුස්සනා ගතියක් දැනෙන්න පුළුවන්. ඒ කියන්නේ වෙනද බොහෝම මේ කාම් වෙනද බොහෝම සංසුන් එක්කනෙට නුරුත්සනා ගතියක් දැනෙන්න පුළුවන්. ඒත් එක්කම තරහ යන ගතියක් අර කියන්නේ අර සමහරලාට කියන්නේ මේ අයයාගේ මූණ දැක්කහමත් නිකන් බය හිතෙනවා ඒකට අබ දැම්මොත් පුපුරනවා වගේ කියලා අර එච්චර සමහර වෙලාවට තරහ යන ගතියක් වගේ තියෙන්න පුළුවන්. ඒත් එක්කම සමහර like in addition to that, like people feel like uncertain, nervous. Again, like if I were to use some Sinhala words to describe these things, it would be chakitaya. නැත්තම් නිකන් මොකක් හරි නොදන්නා දෙයකට දැනෙන නුහුරු නුපුරුදු බය ගතියක් තියෙන්න පුළුවන්. Tired or feeling overwhelmed. නිතරම දැනෙන ඇඟට දැනෙන තෙහෙට්ටුව. එහෙමත් නැත්තම් නිකන් හැමදේම මහා නිකන් අර කෙන්දක් කන්ද වෙලා වගේ පේන ගතියක්. මහා හිතට දැනෙන අර මහා බර ගතියක් වගේ එකක්. Or else the trouble sleeping, it would be like probably difficulty in getting to sleep. You feel very tired when you go to bed, but you go to bed and you see මේ කොට්ටේ මොකක් හරි වැරද්දක් තියෙනවා. කොට්ටේ හදන්න හදනවා. එහෙම නැත්නම් වෙන මොකක් හරි මේ ඇඳ නිකම් හරි නෑ කියලා හිතෙනවා. මේක මේ මැට්‍රස් එකේ වෙනද නොතිබෙ බොක්කක් තියෙනවා වගේ කියලා හිතෙනවා. ඒත් එක්කම like you can't actually concentrate very well, that your concentration and ability to focus has gone for a 6. So those are the things that we will see in acute stress, but if they are kind of prolonged and persistent, then we call it anxiety. කාන්සාව කියලා අපි කියනවා මේ තත්ත්වයේ දිගින් දිගටම ගියොත්. that is one category of emotional reaction. The other category of emotional reaction would be like we will feel kind of negative and cynical about things. Most of you, like some of like very younger generation might not know, but others might be able to relate to the reference I'm giving. So it is like Chow Chow Kelara Hitie cartoon character ඕක හරියන්නේ අද නම් නානවා හැමදාම සාකච්ඡා ඕක හරියන්නේ නැහැ කියලා අන්න ඒ වගේ අර නිකන් හැම වෙලේම හිතට දැනෙන මහා නෙගටිව් ගතිය නිකන් අර මේ මොකක්වත් අර ගහකට නැග්ගොත් දෙබලක් වගේ කියලා අර කියන කතාවක් තියෙන නේද අන්න ඒ වගේ ගතිය ඒත් එක්කම like මේ අනිත් මිනිස්සු ගැනත් දැනෙන මේ නිකන් බොහොම ඍණාත්මකතාවය it goes beyond that. Like you feel very hopeless about the future, you feel worthless about yourself as well, and you don't actually enjoy things you are doing. And again, like if I may give a kind of example from the popular culture, like අර සින්දුවක් අහලා තියෙනව නේද තියෙනවා කලේ පැන් ඇත නැවුම් රහ නැත කියලා එකක් තියෙන. ඒ කියන්නේ වෙනද තියෙන දේවල් ටික එහෙමමයි. ඒ වුණාට ඒ වගෙන් ලැබෙන වින්දනය, ඒ වගෙන් ලැබෙන ආස්වාදය වෙනදට හුඟක් අඩු වෙන්න පුළුවන්. ඒත් එක්කම like the motivation, even though we have enough energy in our body, like we don't feel like doing anything, can't be bothered in doing anything. කලත් වැඩක් නැහැ, නොකලත් වැඩක් නැහැ කියලා නිකන් මහා මන්දෝත්සාහී ගතියක් දැනෙන්න පුළුවන් ගතියක් එනවා. If these things are kind of prolonged and if these things are like persistent, then there can be two kind of syndromes that we can identify. One is the burnout. It is actually about the job. And other one is depression. It is more about the life in general. Burnout again has kind of three main categories. One thing is like feeling very negative about the job. Like make a ඉස්සර අපි ආසාවෙන් කරපු job එක like we feel uh, why have I selected this field, or why have I selected medicine like in the first place, like or why have I selected nursing, ඇයි මම මේ හෙඳ නිලධාරණයක් උනේ කියන එක. ඒත් එක්කම අර වෙනදා දැනිච්ච නැති මහා තෙහෙට්ටුවක් හැම වෙලේම දැනෙනවා. ඒ කියන්නේ කිසිම දෙයක් කරගන්න ගියාම හරි මහන්සි ගතියක් දැනෙනවා. ඊට අමතරව මේ කාරණා දෙක හින්දාම like we have a reduced professional efficacy. That amount of work that we used to do, the quality of care that we used to give, like both of them can be like reduced and affected. And the other one is depression. Like depression would be very much like feeling dysphoric and feeling low in your mood. Again, the correct words in Sinhalese might not be actually dukkha නිකම් මහා හිත කීරි ගහන ගතිය. එහෙමත් නැත්නම් මූසල ගතියක්, sorry for using this term, but නිකන් මහා කාලකන්ණි ගතියක් වගේ දැනෙන ගතියක් තියෙනවා. ඒත් එක්කම අර මම ඉස්සෙල්ලා කිව්වා වගේ මහා ආත්ම අභිමානයේ අඩුවක්, තමන් ගැනම දැනෙන එපා වීමක්. සමහර ලාවට if this goes on for a while, then we actually don't see the value in our own life. Like we come to a point like we don't care even if we die. Like sometimes it is about like කියන්නේ මහාන වෙන්න හිතනවා කියලා කියන්නේ මහාන වෙන්න හිතනවා කියන්නේ සංසාරයෙන් එතර වෙන්න නෙමෙයි, ජීවිතෙන් අයින්ට වෙන්න. Like it's a very different connotation it has. And like madam actually used this word before, like Nilmini madam, it is about the moral injury. Like this is the third kind of domain that might happen in patients who are persons who are dealing with COVID patients. Yeah. So the moral injury is a psychological distress that result in taking certain decisions or not taking certain decisions which are not in keeping with their moral or ethical code. The example would be a very caring and very concerning kind of physician or a nurse or a doctor will may have to decide actually whether to admit this person, whether to to actually give oxygen to this person or whether to give a ventilator to that person. So probably we might not be able to do all those things because of the limited resources we have. So then actually we might evaluate ourselves negatively, like I could not do that to that person. So if this moral injury in itself is not a mental illness, but it can lead on to something what we call PTSD, so post-traumatic stress disorder. Like, again, like I don't think the full-blown post-traumatic stress disorder may come from the vicarious traumatization that we see in the healthcare workers, but some of the symptoms such as flashbacks. Flashbacks කියන එක ඒ කියන්නේ මම ඒක ආපහු විස්තර කරන්න ගියොත් um, so there's one song like describes it very like vividly in Sinhalese. It is called Nidiyahanatawan Akurnu Sarin Mataka Sihina Sitivili Pubudan. Like Hitanem Nativela Gapi and the Tanakota Hitan Nahane Parata Dakuna Gai Kela Ned. Evage Kaparatam Nika Api Hitan Nativela Vaka Api Matake Tenava අර අපි මෙන්න මේ මනුස්සයට මේ වෙන්ටිලේටර් එකට දාන්න බැරනවා නේ කියලා ඒ මනුස්සයාගේ මූණ එකපාරට අපේ මූණට නිකන් එනවා. ඒ මනුස්සයාගේ හිතේ ඒ මනුස්සයාගේ මූණේ තිබ්බ අසරණභාවය අපේ හිතට එනවා. ඒ වගේම ඒකම අපිට රෑ හීනෙනුත් පේන්න පුළුවන්. ඒ වගේ ඒවා. එහෙමත් නැත්නම් ඒක හින්දාම අපිට නිකන් මහා shame guilty feeling එකක් නිරන්තරයෙන් දැනෙන්න පටන් ගන්න පුළුවන්. ඒත් එක්කම ඒ වගේ ඒවා ගැන මතක් වෙන ඒවා තනිකරම අපි avoid කරන්න පුළුවන්. Or else we will feel on edge all the time, like දොරක් වැහුනොත් එහෙම we jump up, right? එකපාරට පොඩි සද්දයකට ගැස්සෙන ගතියක් එන්න පුළුවන්. එහෙමත් නැත්නම් මාරි ඉස්සෙල්ලා කිව්වා වගේම නිතරම නුරුස්සනා ගතියක්, තරහෙන් ඉන්න ගතියකට එන්නත් පුළුවන්. So we discussed about like 3 areas. Like one area is like stress. Other area is the negativity and the cynicalness. The stress can lead on to anxiety. Negativity and the cynical nature can lead on to burnout or depression. And the moral injury in itself is a significant problem, but it can lead on to the PTSD. So we'll see actually how we might be able to mitigate these things. I'm not going to discuss about how to kind of treat these conditions because I don't think it is within the scope of this talk. But of course, like if these things are happening, like if these things are affecting you very much, it is very important that you reach out to mental health professionals such as Chaturi or anyone else. But before we get to that stage, like how we can prevent these things, it's a question that we need to ask, I think. Yeah, the first thing in resolving any problem is actually realizing that there is a problem, right? If we do not realize there's a problem, then we can't actually think about a solution. So acknowledging, recognizing your emotions is very important. What happens, like what I have seen within myself as well as what I have seen in most of these people, particularly Sri Lankan people, is actually we don't like recognize or label these emotions. What we do is we actually project it onto other people or other things. For example, if you are feeling a bit anxious or if you are feeling a bit down, අපි එක්කෝ අපේ ඒක ජොබ් එකට දානවා නේද මේක
හරි
like we like put it onto our job, මේක මහා මූසල ජොබ් එකක් කියලා හිතනවා. එහෙම නැත්නම් we put it into our like partner, like we think මොනාදනේ ඔහොම ඉන්නේ පොඩ්ඩක් hina වෙලා ඉන්නකො දැක්කම දවසෙම ඉවරයි කියලා. එහෙම නැත්නම් we actually like take it on a three-wheeler driver or some other person who is on the road, like in form of very covert road rage නේද? අපි ඒ මනුස්සයා එක්ක කපාගෙන යන්න හදනවා. එහෙම නැත්නම් අපි හිතනවා හැප්පිලා මොනා හරි වෙන්න කියලා ඒ මනුස්සයාට නේද? Actually the problem is like our emotions. Like if we actually realize like we are feeling very down and things like that, then we might be able to actually understand it is not anything to do with our job, our partner, or the people on the road. It is more about ourselves, right? So we need to label those things, and it is very important that we discuss these things with other people as well. I'm not telling you like like we need to discuss about our very personal problem with other people, but we need to discuss like something strange is happening like within us. We can either discuss it with our partner, with our family, like with friends, or with the work colleagues. The importance of talking with the work colleagues is actually they know what you are going through as well, so they have very good point of reference. Yeah. So even if you are not going to discuss about our problems with the partner, like the partners, or with the work colleagues or other people, it is very important that we have a social connectedness. Like if we feel that we are connected to someone else, like that itself like make us very resilient. Again, like I tend to take examples from songs a lot, but again අහස පොළොව වටපිටාව හරිම හිස්තැනක් කියන එක කියන්නේ අර මේ ඇදී එන්නේ ඒ මොහොතේ හඩා වැටෙන හද මඩලට ඔබයි මම ඉන්නා තැන මම මේ කියන්නේ ඉන්ටිමේට් රිලේෂන්ෂිප් එකක් ගැන නෙමෙයි ඕනිම එකක් ගැන right වෙන කවුරු ඉන්නවා කියලා අපිට දැනෙනවා ඒකත් එක්ක දැනෙන ඒ resilience එක හයිය හරි වැදගත් දෙයක්. So that is very important. And it is important to take breaks during the long shifts, like breaks in the sense I'm not talking about 30 minutes or anything like that, 5 minutes, but make the best out of that break. Take a complete mental break, and if possible some physical break as well. Mental break in the sense like don't think about anything that is happening in the work and things like that. If you can, and if you are able to listen to a song that you like, or talk to someone who is not negative, talk to someone who is not going to put any more problems in your like mind. As well as if you can take a relax pace walk somewhere. Like I'm again not talking about like going far away, but just on the like hospital corridor, that itself would be enough. Or going to hospital canteen and having a tea with one of your colleague would be a very nice thing to do. And being mindful. I'm not going to discuss about mindfulness in detail because it would be I'm not doing any justice to mindfulness when Deepal is there talking about it. But like mindfulness කිව්වහම හුඟක් කට්ටිය හිතන්නේ භාවනා කරන එක කියලා. ඒක විතරක් නෙවෙයි මම හිතන්නේ දීපාල් එකෙන් හුඟක් කතා කරයි. ඒ කියන්නේ අපි කරන දේ එළඹ සිහියෙන් කරන එක සහ වෙලාවක් තියෙනවා නම් විනාඩි 5ක් විතර අරගෙන අපිට ඇත්තටම අපේ මොකක් හරි හිත ගැන අපේ මේ හුස්ම ගන්න එක ගැන කරන්න පුළුවන් නම් that would be a great thing. And it is very important that we actually realize like these are very uncertain times, like certain things we can't control. So understand certain things cannot be controlled. When certain things can be controlled, try to control them. Like අර මං සාමාන්‍ය කතා කරනකොට මං කියන එකක් තියෙනවා serenity prayer කියලා එකක් තියෙනවා. God give me the serenity or the courage to change things. Like serenity or courage, serenity or the uh, tolerance to tolerate things I can't change, courage to change things I can change, and the wisdom to know the difference between the two. Again, මට වෙනස් කරන්න බැරි දේවල් වෙනස් කරන්න දරා ගන්න මට ශක්තිය දෙන්න, වෙනස් කරන්න පුරුවන් දේවල් වෙනස් කරන්න මට උද්‍යෝගය දෙන්න, මේ දෙක අතර වෙනස අඳුර ගන්න මට ප්‍රඥාව දෙන්න, නුවණැස දෙන්න කියන එක. ඉතින් අපිට සමහර දේවල් වෙනස් කරන්න බෑ. ඒවා අපි තේරුම් අරගන්න ඕනේ. වෙනස් කරන්න පුළුවන් දේවල්. ඒ කියන්නේ අපිට සමහර දේවල් තියෙනවා වෙනස් කරන්න පුළුවන් දේවල්. උදාහරණයක් හැටියට අපි ඇත්තටම exercise කරන එක is like people might think it's a very prescriptive thing. It's a very difficult thing to do, but actually if we wake up about 10 minutes early, that we might get actually some time, like 10 minutes to like do some exercise. I'm not talking about exercise for physical things, like again it is out of my league, so I'm not going to discuss about those things. But for mental health purposes, like even 10 minutes of physical exercise would be more than enough. And being gentle with yourself and being gentle with other people. මේක කරන්න ඕනි මං කොහොම හරි මට මේක කරගන්න බැරි වුණා ඒක හින්දා මම ෆේලියර් එකක් කියලා හිතන එකවත් අනිත් මනුස්සයට මොකක් හරි කරගන්න බැරි වුණාම මේක තමන්ගේ පාර්ට්නර් වෙන්න පුළුවන් තමන්ගේ රෙජිස්ට්‍රාර් වෙන්න පුළුවන් එහෙමත් නැත්නම් තමන් එක වැඩ කරන නර්ස් කෙනෙක් වෙන්න පුළුවන් එයත් එක්ක gentle වෙන එක is very very important and what you eat also important like it is හැම්බෙලේම කොකාකෝලා එකක් බොන්නේ නැතුව සමහර මම දැකලා තියෙනවා එහෙම ඒ කියන්නේ එහෙම කරන කට්ටිය එහෙමත් නැත්නම් තව සමහර අපි ඔය ටිකක් නිකන් නරක දේවල් වලට යමු වෙන්නත් පුළුවන් ඒ කියන්නේ මත්පැන් සමහර වෙලාවට සමහර මත්ද්‍රව්‍ය වලට ඒ වගේවට යමු වෙනවා ඒ පැත්තකනත් පොඩ්ඩක් බලන්න ඕනි ඒත් එක්ක වැඩිපුරම ලංකාවේ මම හිතන්නේ ඒක ලංකාවට එහෙම හුඟක්ම අදාළයි හුඟක් නිවුස් අහන එක ඒක තේරුම නැති වැඩ නේද අපි හුඟක් වෙලාවට ඒකෙන් නෙගටිව් දෙයක් අපිට හම්බෙන වැඩි නිවුස් අහන්න කියලා මම කියන්නේ හැබැයි හැම වෙලේම අහන එක එපා සෝෂල් මීඩියා වල උනත් වැඩිපුර ඉන්න එකෙන් මම හිතන්නේ අපි දකින්නේ හුඟක් නෙගටිව් දේවල් ඒත් එක්ක මට හිතෙනවා අපේ ලයිෆ් එක සෝෂල් මීඩියා වල ඉන්න කට්ටියගේ ඒවට කම්පෙයාර් කරන එකත් it's also very problematic because there's lot goes behind those screens or like their phones or computers so I don't think it is very wise to do that as I mentioned before like if you feel like every day is an uphill battle like things are not getting better and you are on a downward spiral then it's very important actually you take the first step to reach out to someone like some psychiatrist counselor or someone else like who would be able to give you help yeah okay so I'll stop there madam so I'll remain on the forum so I can take questions later on
Thank you very much, Asiri, for that very interesting talk. You used a lot of Sinhala songs with a lot of meaning for people, and I think that made the talk very interesting. And now I would like to invite Chaturi Suravira, Senior Lecturer in Psychiatry, Faculty of Medicine, Colombo. She's a consultant psychiatrist at NHSL. And she has done some research from last couple of months about how to support the frontline healthcare workers, and she has a lot of experience managing healthcare workers in this setting. Over to you, Chaturi, and please type your questions so that we can take the questions at the end.
Thank you very much, Madam, for giving me this opportunity, and thank you all of you for joining in. It's a very important topic, and although I have noticed that although we are talking about the frontline workers so much and they are there all the time, the distress, the hardships that they are undergoing have not been really addressed, and this is multifactorial. So I'm just going to talk to you about what my experience is when when I supported the frontline workers, and also what data is available, and some shortcomings that we have observed. So when it comes to COVID-19, unlike in another illness where the psychological impact is sort of limited to the individual who is having it and the family surrounding it, because any illness can have any psychological trauma or impact. With COVID-19, what happened was the psychological impact went beyond the physical illness. COVID-19 because of the uncertainty, people started sort of suspecting each other. And then lockdowns ආපු හින්දා තිබිච්ච අර සියලුම තමන්ගේ ගතානුගතික ඒ ඔක්කොම ටික නැති වෙලා ගිහිල්ලා ඒකාකාරී රුටීන් එකකට වැටලා තිබ්බා. ඒ රුටීන් එක නැති වෙලා ගියා. Like let's say as doctors, in the morning you wake up, you send the kids to school, and then you run to the hospital. Then perhaps in the afternoon you run to the evening, run to the general practice or the private practice, and then you come home. There is no time to interact with each other. And then all of a sudden, when that is not there any longer. For a lot of people, they didn't know what to do when that rat race was not there. Some people didn't even know what to do with their spouses when they are there 24/7. And some people so left alone because when they are taken away from their routines, අතෙන්ට යනවා මෙතෙන්ට යනවා සල්ලි හොයනවා දැන් කරගන්න දෙයක් නෑ ගෙදර ඉන්නකොට. ඒක හින්දා there were a lot of social issues which were coming up, which had a psychological impact. And then, of course, the financial burden, the restrictions of traveling, then things for access. I mean, there was limited access to healthcare, limited access to other resources. So all of these things contributed. That is for a normal citizen. So doctors or frontline workers, we are also normal citizens. But then in addition to that, we are exposed to the COVID-19 patients or the activities or the COVID-19 related deaths more than the others. So all of what Dr. Rodrigo described earlier comes into play. Stress එක එන්න පුළුවන්, depression එන්න පුළුවන්, anxiety එන්න පුළුවන්. And even the doctors' lives, even the routines and the hospitals have changed. So that's why it has become different. And in Sri Lanka, it's different again, because we might not be having the resources properly, and we were not really used to this kind of pandemics. Everything was new. We were not used to lockdowns. We did not know about the face mask and the PPEs, most of the people. So then that was also very much of an obstacle. So that's why, apart from the physical issues, the psychological impact was more, and more so in the frontline workers and more so for us. So just to give you a briefing about what's the situation in Sri Lanka, I'm going to quote two studies. This was a comparison of the psychological distress between the doctors in National Hospital of Sri Lanka, Lady Ridgeway Hospital, and IDH, and it was compared against the medical students. And the medical students, their scores were, GHQ scores were high, averaging 14.3, whereas the doctors, it was high, which was higher in comparison to the other regions in the Asia. But it was definitely high. And mind you, this was during the first and the second peaks, second waves. So that was something significant we found. And about 75% of the doctors were psychologically distressed in the samples that we assessed. And this is another study which was done by a team in Colombo South Teaching Hospital. So normal figures are here: mild depression, moderate, severe, extremely severe, and then anxiety and the stress score. So a significant number was experiencing depression, anxiety, and stress. So when looking at the factors which have been contributed to the psychological distress, let's see what they said. ගොඩක් කට්ටිය, they were worried about their health. අපිට corona හැදෙයිද? එහෙම නැත්නම් අපේ තියෙන අනිත් existing illness එකක් මේක හින්දා වැඩි වේද? So 65%, but mainly this was focused on corona. 90% were worried about the health of their loved ones. Am I going to give COVID-19 to my parents? What are we going to do? And about 90% thought that they are having a moderate or higher risk of acquiring COVID-19. And 56% thought that there is some impact on the income. And this varied with the level of their profession. Like the junior most doctors were worried more. And 67%, they were worried about their inability to attend to their daily routine. And a lot of participants included postgraduate trainees. So they were particularly probably worried. So that's why this figure is higher here. And about 75% perceive the response by the public as unfavorable towards the medical profession. Because I was, along with others, I was attending to the uh, hotline of the frontline workers, and they were actually stigmatized in certain areas. ගෙවල් වලට යන්න දීලා තිබ්බේ නැහැ, and සමහරුන්ට මොනවත් බඩු ටික ගන්න විදිහක් තිබ්බේ නැහැ. Like it was going both ways. සමහර ඒගොල්ලන්ගේ උදව් කරලා තිබ්බා, ගේට් එකේ ඇවිල්ලා එල්ලලා තිබ්බා, ඒ වගේ ඒවා තිබ්බා. But in certain areas it was not so good. වෙනදට ආපු vehicle එකේ නගින්න බැරි වෙලා තිබ්බා, බස් එකට ගන්න බැරි වෙලා තිබ්බා. So these people, unlike in other countries who are relying on public transport, they could not come. And even the allocated buses, which were employed during the lockdown, sometimes they were not taking. Particularly, there were certain wards, certain institutions uh, uh, who experienced this. And this I found as interesting, thought that being a junior doctor is a high risk factor for high exposure. Something that we all should be thinking about. So they were having extra worries about that. And excessive information was distressing. I mean, the doctors and the frontline workers, they were getting first-hand experience. I thought කොහෙන්වත් අහන්න ඕනේ නැහැ. So, but then එහෙම මෙහෙන් අහනකොටත් their stress increased. And this again, we have to always balance our work with the responsibilities, the patient cares. We knew that a lot of injustice is happening to some of the patients, being neglected and so on. 15%, which I thought was significant, stated that they would have not worked due to the risk if possible. And females, nurses, and those aged between 25 to 30, roughly, if you take the two studies combined, 25 to 40, had higher levels of depression, anxiety, and stress. And this was actually reflected in the analysis of the frontline caller logs as well, because most of the people who were seeking help was from about 30 to 40. And healthcare workers in units with a higher risk of exposure to COVID-19 had greater levels of stress and anxiety. However, when we analyze the NHSL, IDH, and the Lady Ridgeway, a lot of people, the scores were almost similar. So therefore, probably because the uncertainty is less at IDH, and although the numbers are less, because the uncertainty is high at NHSL and LRH, probably that was the reason why the scores were somewhat the same. And this 61.4 of the frontline workers had found it difficult to obtain food during their shifts. 41.8 experienced difficulties in transport facilities. And I came across a patient who was actually depressed because of the transport facilities. I know you might find it difficult to believe, but වෙනදට යන්නේ නැ බස් එක නැහැ. ඒ වුණාට අපේ ගෙදරට කිට්ටුව නෙමෙයිනේ සාමාන්‍යයෙන් ස්ටේෂන්ස් තියෙන්නේ. එතකොට මෙයාට යන්න එන විදිහක් තිබ්බේ නැහැ. And husband පුළුවන් තරම් shifts මාරු කරගන්න බලලා තිබ්බ, who was a non medical person, but it didn't work out. And then she was getting into, it is like a vicious cycle. She was getting into trouble with the husband, with the in-laws, and then she was getting into trouble at the workplace as well. And also when being junior, linking to that, ගොඩක් වෙලාවට junior කට්ටියව roster කරලා තිබ්බ ඇත්තටම වැඩි. So that was reflected in the study as well. And 85% requested for better availability of PPE. So those things, because we all know the more we take precautions against contracting the illness, the lesser the anxiety there is going to be. So PPE, whatever the equipment that is needed, is indirectly going to lessen the anxiety levels. And 29.7 experienced stigma due to working with patients with COVID-19. That was what I was mentioning about the community and how they treated, and they had no access to go to certain shops and so on. So when I sort of categorize them, the factors associated with distress, Yes, the physical factors are there, like they were scared of getting COVID-19 and the whole process of, like, let's say, quarantining process and so on. So they were scared of getting the disease. And the social factors, which I mentioned about. And also there were the psychological factors contributing, which I would be talking later on. And when it comes to tackling these three major factors, these are the factors that which I have mentioned in the right that contributed. තනි පුද්ගලයෙක් විදිහට අපි කොහොමද හිතන්නේ, අපි කොහොමද වැඩ කරන්නේ කියන එක මේ distress එකට බලපානවා. Because let's say, my personality, is it something which is very worrisome? හැමතිස්සෙම Dr. ආසිරි රොඩ්රිගෝ කිව්වා වගේ අරක ගැනත් worry වෙනවා, මේක ගැනත් worry වෙනවා. And worry වෙලා අපිට එන sympathetic symptoms වලටත් worry වෙනවා. ඒ දන්නේ මගේ පපුව ඩිඩ් ගානේ. And sometimes, like, when you're scared, you breathe heavily and ඒකටත් බය වෙනවා. So that kind of personality at the individual level contributes to the distress. And then the family level, because ගෙදර කට්ටිය එක පැත්තකින් over protective වෙලා රස්සාවට යන්න එපා නේ පුතේ මොනවා වේද දන්නේ නැහැ කියලා කියනවා. And then if your spouse or the partner is non-medical, then there are issues there. How come you're exposing yourself to COVID-19 patients? So those were issues. Because when there was a very strong bond, this was something which came up about the SUA video program. Because you might be aware that people who got higher points during the first and the second wave, the Ministry of Health offered, according to a point system, some way of sort of like holidays in hospitals, in hotels. So then one of the sessions that we had was sort of like a counseling, discussion session as with the whole family as to what their problems were and how they sorted out, and if it comes again, what should be corrected. So most of the, like, psychiatrists from each area where the hotels were situated went there and sort of discussed these issues with the families. So what they felt was like, a lot of distress was coming out because they were not able to go home, and also less access was there. And then even if they do go home, they limited themselves to rooms or isolated areas because they not want to give it to the kids or the spouse or the elderly parents. So the family came up a lot. And then community, because how they treated and what happened. Workplace, සමහර ඒවා එකම කට්ටිය තමයි roster වෙලා තිබ්බේ. Where some people were sort of taken out from the, not really commonly happening, but that happened. So the workplace, and also some people were overburdened in a sense. And there again, it links to the personality, because most in our country, we are not willing to be assertive. We are scared to be assertive. No matter how much we are stressed and distressed, we don't know how to refuse overworking in a nice way. So personality again contributes there. And area and province. A lot of people were distressed from the Western province. So because I suppose the COVID-19 was more rampant here. And to the caller lines also, more calls were from the Western province. So area was an issue. But then one could argue saying there are more facilities. Like for transport in province, in the Western province, whereas in other areas where there were calls from Ratnapura and or these areas where there were issues because they were not able to come to work during the lockdown, and they were asked to give explanations, and there were issues coming up there. National wise, like the vaccine program. So those are the things which came into play when we consider the factors of distress according to our experience in Sri Lanka. So what can be done at the individual level? Because we are here to sort of to find out what we can do and what are the things that can be done easily, most of which Dr. Asiri addressed. So some things which when we analyzed the data that we came up was the personality mattered. Some people, they wanted to do everything so very correctly, like the rigid personalities, sticking to the routines, then that caused distress. Because yes, we have to stick to our precautions, like, hand washing and everything. But then if we try to overdo it, that causes a distress. And we can't be too flexible either. I mean, we have to wear the proper face mask. We can't take, and if we can't be taking shortcuts. So personality matters, being assertiveness matters. And also, some people, when taken out from the busy schedules, they were distressed because they didn't know what to do. So a good time for all of us to think as to what we are doing for ourselves. Do we have leisure activities? How much of connectedness do we have with our family? පවුල කට්ටියත් එක්ක අපිට එකට ඉන්න පුළුවන්ද? Domestic violence කොච්චර වැඩි වුණාද කිව්වොතින්, and mind you, මේක මේ එක්තරා ස්තරයකට විතරක් නෙමෙයි, ඩොක්ටර්ස්ලා, නර්සස්ලා හැම තැනකම තිබ්බා. Domestic violence, අපි හිතමු දැන් verbal abuse එක හරි emotional abuse එක හරි මේ husband ගේ wife ට කියලා calls ගන්නත් බැරි වුණා ඒගොල්ලන්ට help කරන්න. 1926 helpline එකේ one of the observations was calls වැඩි වෙලා තියෙන්නේ lockdown එක ඉවරුණායින් පස්සේ, because the person who is doing it also is inside the household. So that was how helpless some of the people were. And then the families, schedule කරනේවා, එක්කෙනාට support කරන්නේ කොහොමද? දැන් පැය 24ම හැමෝම ඉන්නකොට each and every individual needs some personal space also. And also respect towards each partners, like, it's so difficult to do online work, online teaching to a female rather than to a male, because like, ගෙදර වැඩයි ඔක්කොමත් එක්ක තමයි කරන්න වෙන්නේ. And then parenting, doctors like nurses like ඒ වැඩ කරන ගම දැන් ගෙදර බබාලට උගන්වන්නත් වෙලා. That has created a lot of stress. A lot of people are complaining about it. අනිත් කට්ටිය අම්මලාගේ තාත්තලා ගෙදර ඉඳගෙන වැඩට උදව් කරනකොට මේ බබාලා බය වෙලා ගෙදෙට්ට වෙලා for one side COVID-19 අපේ අම්මිට හරි තාත්තට හරි හැතේද කියලා බය වෙනවා. අනිත් පැත්තෙන් online මේවක වැඩ කරන්නේ නැහැ, මේ හරියට පැවරුම ඇවිල්ලා නැහැ, and teacher වෙලාවකට කියනවා අම්මට උත්තරයක් දාන්න කියලා. අන්න ඒ වගේ දේවල් වල හිර වෙලා. So those were the stressors that some of the frontline worker families experienced. And issues with parenting. මොකද කලබල වෙලා මහන්සි වෙලා ඇවිල්ලා අර ගෙදර තියෙන ප්‍රශ්න ටික කොහොම විසඳන්න ඕන. So then they get irritable and they don't know how to cope with it. So take some time for yourself. And then, because what we experienced was most of them were not depressed or anxious to the level that they had to be treated. But workplace and community area, province, national wise, I'm not going to talk about it because it's more beyond our scope. So what are the things available in Sri Lanka for help? If you need help, if you develop some of the symptoms or distress, or you think that there is counseling or something needed, which Dr. Asir Rodrigo mentioned about. This is the hotline for the frontline workers, 0712 578 578. This is conducted by the Sri Lanka College of Psychiatrists, and the rostered people who will be dealing with your problems are mostly consultants, sometimes senior registrars. So you can seek help, because something that we noted was, although there were issues, we get to know issues, but help-seeking behavior is a little less. Don't suffer in silence. This is dedicated for y'all. And there are these messages. I know you might be looking at the little girl's face, but there are things that have been put underneath what you can do. Call a friend, take a walk. පුංචි පොඩ්ඩෙක්ට හිනා පොඩ්ඩක් දෙමු. නැති කෙනෙකුට අපේ ඇති දෙයක් දෙමු. චුට්ටක් නැවතී වෙහෙස නිවාගමු. And we have to keep in mind, it's all right to feel stressed. So stress up to a degree is normal. That itself, knowing that, calms you down. another helpline, 1926, which is by the National Institute of Mental Health. You can call this line. There are trained personnel handling this under the supervision of consultant psychiatrists. So 1926 is available, and your confidentiality, all the details will be very much protected. 1333, the CCC line is available. Some of the things which I already mentioned, Suaviro program, there was actually a sort of like a mentoring process going on in that program as well, where there was a dedicated time given with the psychiatrist for the whole family, because most of those people were from IDH and who were working in the COVID units. And then individual psychiatry units in each hospital, they have their own plans and they have their own programs. So you have to be like, attentive of them. Because confidentiality is maintained, you have to seek help, because it's very, very important that we maintain our psychological well-being in order to help others, because otherwise we won't be able to carry out our duties properly. So there are things that you can do, which Dr. Asiri mentioned, and I mentioned some of the things. And there are people to help also. So you don't have to suffer in silence. You have to reach out. Even in Sri Lanka, there are ways of doing things. I mean, there are things in place so that you can get help. Thank you.
Thank you very much, Chaturi, for that excellent talk and your sharing your local experience with some research project. And now I'd like to call upon Mr. Deepal Suryarachi to update us on how to manage this stress and all the problems with using mindfulness.
Thank you, Doctor. And I'm indeed happy that I can contribute even in a little manner to what you guys are going through. And actually, it was very, very, it was heavy to hear what you all are going through. And personally, I could empathize with you because we had a family situation. And in that, I remember these doctors in the US, they said, in this full PPE, they said, please pray for us as well. It summarized the whole feelings that you mentioned. And it was very, very interesting listening to both Asiri and Chaturi. What I will try to do is try to bring some practical aspects from mindfulness. I'm not an expert on psychiatry or anything from the medical side. I'm a very ordinary person who has been practicing mindfulness, so I have some experiences. Possibly you can make use of it. But let me start with a little story so that we get back to a little lighter moment. I don't know whether you remember, sometime back, there was a TV series called Kung Fu. The Kung Fu TV series, it was about a man who was a Shaolin monk in his childhood. And he goes back to America, West America, and then he gets into trouble every time with some people because he fights injustice. And then whenever he is in difficult moment, it flashbacks a lesson that he learned. So one day he was put into a pit with a lot of snakes. And he suddenly remembered the lesson as a young Shaolin monk, what he learned. Be one with the moment. And this has really ingrained in my mind. I was about 18 years of age at that time. I took a trip to Badulla by train. Badulla to Kochi aneka hari sundara addakimak. Tar mage balapuruttu tibune janeleyak aine me asanayak hambwela bohoma lassanta watapitawa balagena Badullata yanna. But I got late to get into the station, and then the place I got was the space between the toilet in the third class compartment and that little space. So there's no window there. And it was packed to the brim. And, little by little, people started using the toilet. So they started to smell bad. And it was very difficult to stay. Suddenly, I remembered the Kung Fu lesson. Be one with the problem. So when I listened to Asiri and when I listened to the problem, the whole thing in deep down is when we are in conflict with reality, whatever it is. That is the fundamental issue. පවතින යථාර්ථයත් සමග මගේ තියෙන අකමැත්ත ගැටීම තමයි මේ සියල්ලේ මුල. මොකද අපි පුරුදු වෙලා තියෙනවා. ඒක අපි හිතලා පුරුදු වෙච්ච එකක් නෙමෙයි මම හිතන්නේ. ඒක අපේ හැටි. අපි හිතනවා අපිට මේ ගොඩාක් දේවල් කන්ට්‍රෝල් කරන්න පුළුවන් කියලා. We are control freaks in many ways. That's why we think it has to happen this way. I like Asiri's bringing up that serenity prayer. Give me courage to change the things I can and accept the things I cannot, and the wisdom to know which is what. So, and the second thing is that we have developed this ability to project the past into the present and the future, and imagine the future by being here. So most of these things are coming from either the fear. If it is fear, it's coming definitely from the future. And if it is worries, it's definitely coming from the past. Nothing is here in this moment. So mindfulness helps us to come to the present moment, and very importantly, to understand what's happening here and now. So once you know your emotional state, I think 50% of the problem is solved. Otherwise, what happens is what emotion, you are moved by the emotion, like anger, dislike, likeness. All these are emotions, and emotions move us without our knowing. And then we get pushed over the edge. So if you look at all these techniques that are there to manage stress, first is to recognize and acknowledge, as Asiri very beautifully explained. Now, to do that also, you need to be a little bit distanced from you to know, okay, I have this problem. And when you realize that also we are conditioned not to accept, we want to reject, thinking, no, it can't be me. It can't be me, that kind of thing. And mindfulness help us to bring us to face with reality without getting involved. Now, when we get involved, we lose perspective. The moment we lose perspective, we cannot understand what's happening. ඕනෑම දෙයක් මගේ වුණාම මට ඒක දරා ගන්න බැරි වෙනවා. ඒක ඕනට වැඩිය තදින් අල්ලගත්තාම. ඒතර mindfulness නැත්නම් මේ සතිමත් භාවයෙන් කරන්නේ මෙන්න මේ හැකියාව ලබා දෙන එක ප්‍රාථමික වශයෙන්. ඒක ගොඩක් ගැඹුරට යන්න පුළුවන්. නමුත් මූලිකවම ඒක තමයි සිද්ධ වෙන්නේ. මෙතෙන්දී මම ගොඩක් වෙලාවට පාවිච්චි කරන වචනයක් තමයි ඔබ ඔබේ දරුවා වුණා නම් මම මගේ දරුවා නම් කොහොමද මම මා කෙරෙහි පවත්වන්නේ? If you are your own child, how do you relate to? Most of the times we are too harsh on ourselves. We are not gentle on ourselves. Why? Because we think we can control a lot of things, but in reality we cannot control. So in mindfulness, what we learn is first to slow down and observe what happens and become aware of what's happening, what is being experienced here and now. So once you become aware of things, then you can let go of things that are not relevant, that are painful, and not in a rejecting manner, but when you realize, no big deal. Once you come to that, it's very interesting how light you become. Mindfulness is not like a Panadol that you can take unless you have been practicing it. But you can start practicing right now. So what I would like to do is, in the next few minutes, we'll do a small guided session so that you get a taste of what it is. And then we'll discuss a few points, how you can put it into practice. Sit comfortably wherever you are. And it's useful if you can gently close your eyes and bring your attention inward and come home to where you are. The first thing you can do is to experience the physical sensations in your body. Maybe we can start with our feet and feel the sensations. Where do they rest? What are the feelings you get? Cold, heat? Are there any pains? And slowly bring your awareness along the leg, up to the knee and thighs. If you are sitting on a chair, how does your weight get spread through the buttocks? Cloth touching your body. How are you keeping your arms? Where are they resting? Just feel the sensations, touch sensations, any other feelings that you can notice. And slowly bring your awareness along the trunk. You might notice that you are breathing. You might notice the rise and fall of your tummy and the chest area. You might notice some tensions in your back, the shoulders, along the neck. Where do you keep your tongue in your mouth? Just notice. For a few seconds, try to be with your body and noticing any sensations. If you feel any pain, tension, gently massage that place in your mind and ask that place to relax. Allow your body to relax in wherever you are. You might hear sounds in the environment around you. Just notice how they come and how they go. Notice that there is silence in between sounds. You might experience some silence inside you. Try to notice whether there are any thoughts in your mind. If it is not relevant to this moment, gently tell, not now. Or you can just notice, oh, I'm thinking. When you do this for a few seconds, some time, you might begin to notice that you are breathing. Don't interfere with the breath. You have nothing to do with it. It happens naturally. Keep watching your breath. Just keep watching. No forcing, no interfering. Keep watching the breath. And while watching the breath, if something pops up in your mind, just notice and find where the breath is. So the breath kind of becomes your home. Navata navata husmata enna. උත්සාහයක් නැතුව හුස්ම දිහා බලාගෙන ඉන්න. නැවතත් තමන්ගේ සම්පූර්ණ ශරීරය පිළිබඳ අවධානය යොමු කරන්න. Once again, pay attention to your entire body, the way you are seated, and bring a gentle smile to your face and slowly open your eyes. So this is 2-3 minutes. So that's what you could do. And initially you can probably use, there's enough of guided short sessions on YouTube, and even on my YouTube channel, there's a guided session. Take something like that and use it to practice whenever you are. And there's another very interesting practice that you can do, is to do a little bit of walking. Dr. Azari mentioned you can take a little walk. So take a few steps in the corridor, and while walking, try to feel the walk. Try to be only with the walking without thinking. And if the mind picks up something else, become aware and come back to the walking. And you can do it anything that you want to do. Right? You can even take a cup of tea and then see whether you can enjoy it for a few sips, fully focused on it, whatever you are doing. So what you learn by doing these things is you learn to bring your attention back to the present moment. And present moment, if you manage well, the next moment also become better. So everything is created in the present moment. Your past was a present moment at that time. And your future hasn't come, but present will flow into the future. So therefore, you learn to be here and now. And once you create this ability, so when you are watching your breath, the moment you realize you are not watching the breath, but thinking about something, that moment you become aware of what was happening. So that's a good sign. Oh, you're aware. So then you let go of that other thought and come back to what you were doing. So when you keep doing this over and over again, over a period of time, your ability to come back to the present moment becomes strong. And when you develop this ability further, you begin to experience and you begin to develop the ability to notice the intentions and the emotions that you're going. මේ අභ්‍යාසය නිතර අපි කරනකොට අපිට පුළුවන්කම ලැබෙනවා මේ මොහොතට සිහිය ලැබව ගන්න. මේ මොහොතේ වෙන්නේ මොකක්ද කියලා දැනගන්න. ඒ දැනගැනීම තුලම අපිට ඇති වෙනවා මේ අවස්ථාව පිළිබඳ අවබෝධය. ගොඩක් වෙලාවට අපිට මේ මොහොතේ වෙන්නේ මොකද්ද කියලා දැනෙන්නේ නැහැ. සමහර ලාට ඒක දැනෙන්නේ ඒ සිද්ධියට පස්සේ. නමුත් අපි හැමෝගාම තියෙනවා මේ දැනගැනීමේ හැකියාව. මෙන්න මේ නිසා අපිට පුළුවන් වෙනවා අර කලින් කතා කරපු දේවල් කරන්න. මේ මොහොත ගැන මට අහන්න හම්බ වෙච්ච ඉතාම ප්‍රබල වචනයක් තමයි මේක ජපන් වචනේ මම හරි ආසයි මේකට. මේකට කියනවා ඉචිගෝ ඉචිය කියලා. මම හිතන්නේ ඔබ මේක අත්දකින්න. ඒ ජපන් කියමනෙන් කියන්නේ one life one meeting. මේ මොහොත තමයි තියෙන උතුම්ම මොහොත. මේ මොහොතේ මං ඉස්සරහා ඉන්න එක්කෙනා තමයි ඉන්න most important person. මේ වෙලාවේ මම කරන දේ තමයි the most important thing. So when you bring this attitude to anything, then even in the most difficult moment, you will get that energy that you need. So when you keep practicing mindfulness, right, you can find a few minutes early in the morning, or you can find few minutes in between work, when your vehicle is parked in front of the traffic light, when you have to wait for something, find that moment and notice where your breath is. So breath is fantastic because you know about breath more than I. Right? හුස්ම තමයි හැමතිස්සෙම අපි ගාව තියෙන්නේ. ඉතින් හුස්ම දිහා බලනකොට අපි මේ මොහොතේ because අපිට පහුගිය හුස්මක් දිහා බලන්න බෑ. ගන්න තියෙන හුස්මක් දිහා බලන්නත් බෑ. බලන්න පුළුවන් මේ ගන්නා හුස්ම විතරයි. මේ මොහොතේ ඒ හුස්ම ඇවිල්ලා යනවා. ඒක ටිකක් ගැඹුරෙන් පුරුදු වෙනකොට තේරෙනවා ඒකත් හිමින් ඒකෙත් අවස්ථා තියෙනවා කියලා. ඉතින් අන්නේ තරම් සියුම්ව දකින්න පටන් ගන්නකොට ඔබ තුල ඇති වෙනවා මේ අවිනිශ්චිතතාවයට හිතෙන් මේ චිත්‍ර මවනකොට ඇති වෙන බියකුරු බවට මුහුණ දෙන්න අවශ්‍ය ශක්තිය. ඒක හැරියට අර ව්‍යායාම කිරීමෙන් මාංශ පේශියක් ශක්තිමත් වුනහම අවස්ථාවකදී මුහුණ දෙන්න පුළුවන් වගේ බරක් උසුලන්න ආතතියක් ගන්න. When your mind is constantly practiced with mindfulness, then what happens is, without your knowledge, your mind becomes stronger. Muscles get stronger when they are exercised, but on the other hand, the mind becomes stronger when you learn the mind to get settled. When you know that settling nature of the mind, when you can touch that, then in that space there is freedom, there is silence, and in that silence there's happiness. So in all these challenging moments, may all of you be happy, enjoying that moment. Whatever the difficult things, may you have the courage to be one with the moment. Thank you.
Thank you, Deepal, for that very interesting talk and giving some insight into how to do this mindfulness practice. If there are any questions, can we please see the questions on the chat box? I can't see any questions. I think everybody is having, everything is very clear. To the panelists, you all have anything to share? Siri?
නෑ මැඩම් මම විශේෂ දෙයක් නැහැ.
Okay. So Chaturi?
එහෙම නෑ madam, like any questions we can definitely answer.
I'm sure everybody has no questions now. They are so, you all have said everything so clearly, and I think it was very, very relaxing moment also. I know that your talk was quite heavy to hear, as Deepa said, because we learned about the true picture with some numbers. We knew there were some problems, but we never knew that it was so bad. Anyway, thank you very much on behalf of the College of Anesthesiologists and Intensivists of Sri Lanka. I would like to thank all our speakers for your valuable, spending your valuable time with us and to give this insight. And if Chaturi can send us those numbers that you sent,
Yes,
you
madam.
put on your ears, so that I can share with our groups. Anybody who needs help, please don't feel shy. Be assertive. Talk to them. They are very helpful, and I think that will be. Even Mr. Deepal, maybe you can help, and I can, if you don't mind, can I share your email with the group?
Yes, please. Yes, please.
So, and Asiri, of course, also can help by distant.
Yeah, it's
consultation.
he's a natural distance healer.
Yes, yeah. So, thank you very much for this evening and for all the good work you all have done, and hope that you can join us in the future as well. Thank you very much. Bye.
Thank you. Thank you for the opportunity. Thanks, Chaturi. Thank you,
Thank
Asiri.
you.
I don't see.